So last time we left off talking about a good book called The Patient Comes Second and how we need to focus on taking care of our caregivers so that they can help take care of our patients. And just like the quote says here, how can we ask our people to help their patients when they too are suffering? So there's a couple things that we talked about in class and then learned from our guest lecture this week. Just understanding those factors and how to remove them. So facilitating that level of understanding. We talked about the difference between empathy and sympathy, the effective use of short team huddles, and how to really work to combat those external stressors. So really the secret for caring for our patients and giving them that world-class, healthcare experience is caring for our caregivers. I want to finish up, we've got two different pieces here that I want to finish up talking about. The first one is talking about this emergence of what's being called the CXO, or the Chief Experience Officer. This is a fairly new C-suite chief level position that we're starting to see emerge at the higher administration levels out in healthcare systems. The CXO, or the Chief Experience Officer, they're really in charge of driving and creating a positive culture in the healthcare environment. So they are focused on quality, safety, and experience strategy that really works to improve the overall patient experience, but the overall team member experience in the healthcare environment. They work a lot to engage patients and their families, as well as the clinicians and the different team members, not as adversarial, but more equal partners to work to improve the clinical processes. The other piece that we unfortunately didn't get to in class was going over this case study. Now, this is listed out on your D2L site under the Workforce Burnout module. And I want you to take some time just to sit down and go through this individually to really think from an administrative perspective how you would handle this case study that we see centered around this second year internal medicine resident named Anna. Here's just a quick description of what the case study is, but take some time to review over the case study and then go through these different discussion questions that I have listed here. What are some of the unique challenges that hospitals are going to face when we try to implement the supportive organizational culture? And what would you do if you were in Anna's position? What role did culture play in the situation that's presented in the case study? And how would you as an administrator or a manager handle that type of situation? And really, how can you do a little bit of forward thinking and from an organizational perspective work to identify and either prevent or screen for those different types of problems that we were seeing and help team members to maintain that sense of balance. So make sure to go through that case study. You may see it come up in another class, so I want you to be prepared for that. But thoroughly read through that case study. Think about these different discussion questions that we go through. And to end this, just to sum it up with a couple key points, we've drilled it throughout your time in the program now that we have this workforce shortage that we're anticipating, and we really need to start planning for that now on how we're going to handle this, when we start seeing these big workforce shortages that we're anticipating we're going to see. How we need to move out of the mindset and do a paradigm shift from the triple aim and move into the quadruple aim, where we're also focusing on our team members and our employees. And just making sure from an administrative perspective that you are giving your team members and your employees the resources they need to help them alleviate the shortage and the burnout that we are anticipating.